Good evening, everyone. I'm Riley King, and welcome to my evening news report right here on the Riley King Network. Let's begin. 8 new COVID-19 deaths reported in New Hampshire. Antiviral drug remdesivir distributed. 13 New Hampshire hospitals given dose of drug that has shown promise in fighting COVID-19. As 8 more COVID-19 deaths were announced Wednesday in New Hampshire, officials said an antiviral drug that has shown promise in treating the illness has been distributed to state hospitals. Health officials said 7 of the Granite Staters who died were residents of long-term care facilities, which have been at the center of the coronavirus crisis in New Hampshire. More than 120 patients were hospitalized in the state for serious cases of COVID-19. Health Commissioner Lori Shipperton said the state has received 400 vials of the antiviral drug remdesivir, and they have been distributed to 13 New Hampshire hospitals. Remdesivir is being tested to see whether it can be an effective treatment for COVID-19. Some studies have shown that some patients may recover faster if given the drug. The hospitals have received emergency use authorization for remdesivir, which must be administered intravenously in an inpatient setting. Shipperton also announced 63 new cases of COVID-19 in New Hampshire for a total of 3,299 cases in the state since the pandemic begun. The state is continuing to increase its testing rate, Shipperton said. She said that in recent days, New Hampshire has averaged 1,478 tests per day with a 5.5% positivity rate. Tests are also available in New Hampshire to indicate whether someone has antibodies for COVID-19, evidence of an earlier infection. Shipperton said about 211 antibody tests are being performed daily with a positivity rate of less than 3%. And that does it for my evening news report right here on the Riley King Network. I hope you all have a great rest of your evening, and I'll see you back here tomorrow for another news report. Good night and bye, everyone.